been wanting her to give a talk for a while, so great to have you here. Kate is a human geographer whose work is unified by an interest in landscape, place, identity, and social relations in space. Her work asks how social innovation is linked to the particular configuration of people, energy, resources, agencies, and organizations in place. And you also look at the role of volunteers in social innovation. She's the co-director of the Social Innovation Group, along with Mike Leyshon, and I think you're going to start talking about that. And today, Kate is going to tell us about where is everyone finding us and supporting the smallest voluntary sector organization. Thank you so much again for being here.
Hello, I'm going to wave everyone online. I'm not sure if they can see me or not, but welcome to everybody. And I haven't seen who's online, but I'm quite hopeful that some of my really great project partners in the voluntary sector are online, because the work that Mike and I do in the Social Innovation Group couldn't really happen without them. And also really Mike ought to be co-author on this paper, because obviously all of this work goes on in the Social Innovation Group that we co-direct. And this is what we do in general. We look at place-based, person-centered approaches to care. So we are interested not only in what happens to people, but the difference that place makes. And quite a lot of our work is asked what the difference the rural makes, for example, when services are hard to reach and there's much greater need for social innovation in communities. We're also interested in social innovation from the ground up. So how do people and communities identify needs and mechanisms to meet those needs, and how they can be supported to do that. Today I'm going to talk a bit about understanding, supporting and energising the voluntary sector, and we are also generally interested in challenges of integrating the voluntary sector into health and care systems, which is quite a big deal in the United Kingdom and elsewhere, and very difficult to do, especially as the goalposts keep changing. That's a whole other problem. So the question I wanted to answer today is how the microbiome of the smallest, often unregistered voluntary and community groups can be supported in, I call it a new landscape of public service design and delivery in England, but that new landscape, which we thought was had been set about 5 years ago with the creation of integrated care systems, is now undergoing yet another perturbation, which I'll talk about in a minute. So it's not only the existing landscape, but the new landscape, because it's changing all the time. So that's what I want to talk about. I want to give you a bit of big picture first, set the context here, because this context really is important to how we think the voluntary sector, especially the smallest ones, contribute, and the conditions in which they work. So we've had the creation of integrated care systems in England. Cornwall is currently its own integrated care system, number 38, and the integrated care systems are the scale at which all the health and care that you get, whether it's GP or NHS, primary care or secondary care or whatever it is, that's the scale at which it's organised in collaboration between the local authority and the integrated and the health system. And so that is now undergoing, that system that's been around for about 5-ish years, sort of, a bit longer in some places, is now undergoing more perturbation. So Cornwall's integrated care system is going to get mashed up with Devon and make one gigantic integrated care system. And that's happening in other parts of the country as well. So that's one thing that's happening. Local government reform is also happening. That's not going to affect us very much in Cornwall unless there's the creation of a southwest, a big southwest agency, a big strategic authority or combined authority. Not sure about that yet, but elsewhere, the district councils, which disappeared here in 2007, those are going, and quite often the voluntary sector is kind of structured around those district councils. So an example of that would be Lancashire, where there's still 14 districts and they've got local community, council for voluntary sector organisations associated with those places. Funding and commissioning is always changing. Contracts tend to be short-term, underfunded. That sounds familiar, doesn't it, for us as academics, but funding and commissioning is also changing, and there's now examples of new collaborative commissioning models emerging, which might help the voluntary sector. We're increasingly interested in the things that are beyond health, the social determinants of health, things like housing, debt, food, employment, careers, and all of those sorts of things, as well as things like access to nature and green space, which are, on the face of it, nothing to do with everyday health, but are really important for healthy lives and well-being and make a real difference, prevent the escalation of demand into health and care systems. We've also got some new ideas around integrated neighbourhood working, which came out of the 10-year plan, which was published just last year, the NHS 10-year plan. And all across the piece, we've got increased demand. And that's partly because of things like cost of living crisis. We're still downstream of Brexit and COVID. And we're seeing wherever places do state of the sector reports for their voluntary sector, we see increasing demand and ever tighter resources to deliver. So that's the big picture, and that all makes a real difference to the context in which organisations work, voluntary sector organisations work. But interestingly, we actually don't know very much about how many voluntary sector organisations there are and where they are. And that might come as a bit of a surprise, because there's about 135,000 voluntary sector organisations registered on the Charity Commission website and Companies House. So if you're a charity and you've got an income of more than £5,000 and some other conditions, you need to register on Companies House. But many organisations don't have anywhere near £5,000, or they're not actually a charity. They can be an unincorporated association of some kind. So, and there's quite a few categories of that. So there's about 135,000 on the Charity Commission and Companies House, but we think there's about over 300,000 voluntary sector organisations in existence in England. Now, why don't we know? That's the question. And it's because these are often very small organisations. I'll talk about the numbers in a minute. They don't need to be registered anywhere, and arguably they shouldn't be registered anywhere, because that adds a whole bureaucratic layer that they already don't have the time for, the capacity for. So how we know what we know, which isn't very much, is that every so often local infrastructure organisations that look after the voluntary sector on their patch do a state of the sector report. The state of the sector reports are very inconsistent, so people don't ask the same questions. It's a survey. It usually covers things like what's your income, how long have you been in existence, who do you help, what's your geography, what are your reserves, how many volunteers you've got. Really, you can imagine the sort of questions that a state of the sector survey might ask. And they're really, really useful, but they're wildly inconsistent because places don't ask the same questions. They're also of very variable quality. Now, that is not a criticism. They're often being run by people who are already very busy. Running a survey, they might not have had any training in that. It's not necessarily in their wheelhouse. So they can be of really variable quality. They're of completely stochastic frequency. So a lot got done after COVID because the voluntary sector made a huge response to COVID. And then in about 21, 22, a lot of organisations said, right, we need to understand where we are now. That's been such a huge effort. a lot got done in about 2022, but prior to that and since then, they are quite infrequent and of very variable frequency. Those data exist in reports that sit out there in the world, in the locality in which they've been created, but then those data are not gathered centrally, and even if they were, because they're quite inconsistent and of variable quality and frequency, it'd be quite hard to gather those data. And so, because of all of that, a lot of what we think we know about the size and shape of the voluntary sector nationally is based on extrapolation. It's based largely on what we know from the Charity Commission and Companies House, and maybe another couple of other sources. And there's a sort of clever maths involving population, and it's sort of a ratio of that. You know, and it's all a bit, you know, it's basically very interesting guesswork in the nicest possible way. So we've got no idea, and the this is what we're talking about. So if we start at the bottom of this diagram, we have in any given place what are called infrastructure organisations, and these are the ones that support community groups, they support volunteers, they provide leadership, help with collaboration and partnership, capacity building, and supporting volunteers. So an example of that would be here in Cornwall, that would be Volunteer Cornwall, of which I'm a trustee and Mike's a trustee, Voluntary Sector Forum, and so elsewhere in Somerset it would be Spark, in places like Lancashire it would be the community, the Council for Voluntary Sector Organisations up there. So they have their job is to support the voluntary sector in place. Then you've got your larger organisations. These are ones that are quite big. They're providing services. They might be contracted by the council or the NHS. They're providing structural support services. They're running programmes. They're responding to needs, and they're quite big. And then you've got the microbiome. These are very small scale organisations delivering activities. It could be chat cafes, hobby groups, community fridges, knit and natter. And I've got a few, I'll give you a few examples in a minute of ones locally. And then as soon as you see those, you'll be like, oh, okay, I get this now, because this is the sort of organisation we're talking about. In terms of size, these are the income bands that that are used pretty consistently nationally to describe voluntary sector organisations' size by income. And as you can see, we've got very small ones that have an income of less than £10,000, and that's usually money in, money out. So, for example, you might here on campus, I helped run a roller skating group until my knees informed me that running a roller skating group was no longer an option. So we used to book the sports hall. We had literally a Tupperware. People put a couple of quid in the Tupperware, and it went straight to pay for the. We finished the session, went straight to the desk and paid it over to pay for the hall. And that was money in, money out. It was probably about £3,500 a year, but it was money in, money out. All volunteers. So these very small ones are operating. They're not really. They're usually entirely volunteer led. They're not really making any money. It's just money in, money out. Then you've got a small group from £10,000 to £100,000. At £100,000, you might have a couple of employees, or you might have between one and three employees, maybe, but it might also be money in, money out. This group, with an income of less than £100,000, based on current estimates, with all the caveats I've already put on that, represents about 80% of the voluntary sector in England. So it's a huge number. And we don't know for the most part, don't know where they are. We don't know what they do. We don't know what their impact is in terms of helping people and the environment and communities. And because of that, it's very hard to know how to support them or to energise more of that activity. So this is what I'm talking about. So here in Cornwall, we've got EcoStock is an example. It's a group of students. It's a student society. It promotes an understanding of the environment. They do walks. It's all voluntary. Like all student societies, it's voluntary led. We've got Friends of Tregenny Woods here in Falmouth. The two of our students are involved in that, and they would really like more volunteers. So I'm giving them a shout out right now that they would love to see more students down there, and they would love to see more volunteers. And of course, they just had a huge cleanup operation after Storm Goretti. The fact that you can even move about in Tregenny Woods since Storm Goretti is entirely down to that voluntary effort from them, from a very small organisation. This is Falmouth Marine Conservation, and they do beach cleans. They go around looking at beach seals and supporting the marine environment. Small localised group that's doing a good job for the environment. And then the last one on this slide is the Falmouth Green Corridor. This is the route through Tregenny Woods all the way down the stream that comes out the back of Swampole. And again, that's supported by a local group. And just yesterday, I was also hearing about a completely informal group called Creek Watch in Myla. They look out for sewage spills in the creek, of which I now learn there are many. That's just a group of residents of Myla who are not constituted in any way. They're probably a WhatsApp group. They're sharing information and they're badgering South West Water when there's sewage in the water. So they're doing a really important job. But how would you know they were there? A couple more examples. She Swims Falmouth. So this is a group that does cold water swimming and provides a lot of information and support for that. Telltales is a writing group that meets on once a month. I think the next one's tomorrow at Princess Pavilion, so get down there, listen to people reading out their stories. And May Gardening Club, and gardening clubs are actually a classic example of this. Just small organisations that promote gardening, sell plants, look at each other's allotments, all of that. It's really good stuff. Okay, so you're getting a picture now of what this microbiome, as we call it, because we call it the microbiome because it's absolutely crucial to the functioning of society in the same way as your gut microbiome is crucial to the functioning of your body. This microbiome is crucial to the functioning of society. They're doing a lot of work to support the environment, support individuals, to support communities, and we don't know what the impact of that work is. And so we've been working with the National Association of Voluntary and Community Action to think through this problem and try and highlight it to NAVCA members and other stakeholders. NAVCA members are local infrastructure organisations, so they are the organisations that support the rest of the kind of ecosystem of the voluntary sector in place. It's the membership organisation for them, and they do an amazing job in helping their members think through these big strategic issues. So we've been doing some work, and we are brewing up that all the stuff I'm talking about today is part of a much bigger idea that we've been brewing up for a while, where we've been trying to think through not just how you find that microbiome, the smallest voluntary sector organisations, but how you make those state of the sector reports I talked about earlier easier to do and more consistent by providing a question bank that organisations can just go and get, and maybe augment with a few questions of their own, so that it's, there's maybe a pressing issue locally that they need to explore. but they could use the question bank to run a really consistent survey, and those data could come back to us, come back to somewhere nationally, maybe NAVCO or someone else. And then those data could be used to then advocate for the voluntary sector at the national level. And there's been a lot more interest brewing, I feel, in the last year or so. There's been a big report on what's called civic infrastructure. That's not just the voluntary sector, but the voluntary sector is part of that. And there's now a civic society covenant. And I think there was some funding announced, about 11 million quid the other day, for the promotion of civic society institutions. So there's some stuff going on that we'd like to key into. But as I've already said, state of the sector surveys are not perfect. So even if we provided a really good question bank, we would still miss some people, because not all voluntary sector organisations in a place reply to a survey. And especially if they're very small, they don't necessarily understand themselves to be part of a sector. If I'd asked anyone at the roller skating group if they thought they were part of a voluntary sector, they'd be like, no, we're just standing there roller skating, it's great. So it's getting quality and consistency into the state of the sector surveys is only one part of this. So we start on the left-hand side of this diagram. And this is all completely speculative. This is what we want to do. We're trying to find the resources to do it. We're not actually we're only on the left-hand side of this diagram at the moment. So the first thing is to get quality and consistency in data. And we know about the existing sources. Charity Commission, Companies House 360 giving is one of the other ways we can try and establish who's out there and kind of visible online. Then we've got what called relationship management software. So CRMs. This is the software that organisations use. When someone contacts them, they go into the consumer relationship management, the customer relationship management software. And all of you will be in that software somewhere. Organisations use CRMs all the time to remember who's been in touch with them and then contact them. So, of course, local infrastructure organisations have customer relationship management software. We could interrogate those. We could have better state of the sector surveys. And then I'm going to talk about completely analogue methods like fingertip searching and participatory methods that sort of surface the local knowledge about the smallest organisations. Now, you'll notice there's a big red line going across this box, and that's what we call the consent threshold. So everything above that line is in the public domain, more or less. It's searchable. Everything below that line, especially the CRM software, people have agreed to be in one organisation's CRM. They haven't agreed to have that shared with NAVCO or with all the other, with other organisations in the area. So we're working on, we have conversations with local infrastructure organisations about changing their sign-up agreement so that the data from their customer relationship management software could be shared. So that's a consent threshold that we're working on, below which people haven't really agreed to have their information shared. So we have to be really careful. We need to work on that. The next stage is about if we start to get really good quality, consistent data from all of those information gathering sources, how would we store it? We need we need a durable storage solution where information can be easily uploaded. Obviously that comes with governance, information governance and accountability and all of that. But that's some work that NAVCO are doing with Superhighways, which is a consultancy in London. Then we've got, how do you search the data? What are you going to do with those data when you've got it? If we got to the point where it was all in one place, what would we do with it? That's all about interrogating it, visualising it, displaying it, mapping it, training people to use it and give them access to it, all kinds of things. And that's work that hasn't really started yet, although I am going to show you an example of some analysis that one of our former undergraduates, Jen Zhu, is doing. Now he's doing his master's. That bit's very mathsy, and it might all go horribly wrong because everyone knows that this person in front of you is not a math. I'm going to have to call upon Mike to save me at that point. All right, and then how do we, if we manage to get all that lovely data about the voluntary sector, how would we connect it to other kinds of data like indices of multiple deprivation, data on housing or health inequalities to show where the voluntary sector is and where the need is? Is there a gap there? How those voluntary sector organisations might be meeting the need? How do you energise them in relation to that need? That's the big plan. My good friends and colleagues at NAVCA, we talk frequently about how we might actually realise this plan today, you know, gathering tomorrow world. It would be fantastic if we could get to a point where this was realised. But this is what we have in mind when we chip away at this work by whatever means we can. All right, let me talk about the really analogue ways that you can go out and find these organisations, these very small organisations. There's what we call the last mile problem, which is you can get just so far, as I've said, with online resources and places where organisations are registered in some way. But at some point, the only way to find them is to put in the legwork, to work your way around notice boards and parish magazines and things on supermarket notice boards and village notice boards, and get on, and to a certain extent get on Facebook and have a look. A lot of groups use Facebook or Instagram. Some don't use anything at all. Some it's almost just word of mouth in some cases. You know, like the Creek Watch is a WhatsApp group of people in Milo. So this last mile problem requires a very analogue approach to it. And this legwork is the sort of thing that might be done by community navigators or village agents, people whose job it is to work in that voluntary sector ecosystem, to support it, to promote it. They're often employed by local infrastructure organisations to do that work. There's a number of them in Cornwall who do that work. And at least some of it, the solving this last mile problem is literally getting round to where the notice boards are, the community centres, the supermarket notice board. And this picture shows more of a participatory approach where you get a load of people in the room and you get a massive brain dump going. And out of that, you can, you know, out of the very analogue method, which involves a giant piece of paper and some Sharpies, you can then start to build a visualization of the network. I know it's not very clear on the screen. It's produced through a piece of software called Kumu, and it's a very interactive piece of software, so it never does well as a screenshot. But you can dive in and start to explore the connection between people. This is how this went in some my friends and colleagues in Lancashire had a go, and these are the notice boards and the community halls that they went to, and the giant pieces of paper. And the question of what you end up doing with that locally is partly a function of what you need. Preston already had a really good interactive map that they designed, and so they put that information on. They used what they found to augment their local map. But this is literally legwork. Talking to people, using local knowledge, community navigators, village agents, whatever they're called, they are often absolute mines of information. So at the moment, when places have a go, it's usually feeding into a local resource, which is good. We still don't have the mechanism to feed this into a national resource, and that's partly because of that consent threshold I talked about a minute ago. All right, so how does any of this help? If we could find and map and energise more voluntary sector organisations and understand their impact, how will it help? If we're attentive to this microbiome, we end up with much better systems thinking. So when we think about the interactions between the local authority, the health system, the people who look after the organisations that look after the environment, it's important to be as attentive to the smallest parts of the system as the biggest. At the moment, most things are set up to benefit organisations that have got some capacity. They can either apply for grants and funding, or they can be commissioned. That's really hard work. And so better systems thinking would find a way to embrace the smallest as well as the largest. And we also need to embrace the incredible heterogeneity of this sector. So I was just with Voluntary Sector Forum, Active Cornwall the other day, and we were talking about how the heterogeneity is quite multidimensional. It's not only that there's large and small, it's also that there's community interest companies, social enterprises, unincorporated organisations. There's quite a range that need different things, but we should be embracing that heterogeneity because it is incredibly healthy for society. We should be thinking about it when we think about the microbiome. It helps us to understand that we need to nurture and grow it exactly as the same way we take a probiotic, we have good gut health, nurturing and growing this thriving sector of grassroots organisations, and allowing them to continue working below that regulatory and administrative radar, because that's the space in which you get maximum innovation. You get huge amounts of flexibility and responsiveness that you simply don't get in public service provision usually. And it helps us to tackle the things that are the social determinants of health. So the things that make life really hard, if we could get a hold of them a bit better and intervene through innovation, then it improves health and well-being and the livability of our communities. So it really helps to think about the microbiome, but there are some risks. And we don't know what the impact is of these smallest voluntary sector organisations, and that means that, as you've probably intuited by now, they are quite neglected in some ways. It's a sort of benign neglect. If we knew they were there, we'd probably support them much better. But you know, it's hard to know what's there. We also the risk is that the impact can only be expressed in terms that a local authority or a funder would understand, and oftentimes those are very difficult terms to meet for a very small organisation. So we need to rethink the conversation about what constitutes evidence of impact and the important work they do. Most current commissioning and funding models and grant awarding models work against the smallest voluntary sector organisations, but there are really good examples of where that's changing. So Bristol, North Somerset and South Gloucestershire integrated care system has got a really good brokerage platform, and that has been designed to make it possible for much smaller organisations to be commissioned without the enormous administrative and reporting burden that normally falls to them. I've talked a little bit about short-term underfunded contracts and grants. Those are an existential threat. If you can't cover your core costs, if you're one of those ones that's operating at around £100,000 a year, and you've got some core costs, maybe you have a space and some lighting and some heating and some phones, not being able to meet those core costs because grant funding is very locked down is an issue. We also don't want to overwhelm these organisations with bureaucracy. It doesn't help. Quite the opposite, really. We want to create the conditions in which these can grow and be nurtured and support people with the minimum amount of paperwork. And a lot of this, not about nurturing vibrancy and heterogeneity, depends on system maturity. So whether whether the system itself, the operations of local government and other systems in society are mature enough to, and there are actual measures of system maturity. There's a self-assessment exercise that the local authorities can do to determine their system maturity, whether they are mature enough to accept the unique characteristics of the voluntary sector and allow those characteristics to thrive, rather than swamping them with regulation and bureaucracy and paperwork and all of that. Okay, what can we do with what we find out? We're approaching the mathsy bit now. Hopefully I'll run out of time, won't be able to talk about it. But this isn't the mathsy bit. What can we do with what we find out? There's some really amazing innovation going on around the country. This is from Spark in Somerset. This is their impact hub. This is a space in which organisations can report what they've done in a very simple way. They can access knowledge and research about the sector in Somerset. And this is the kind of really innovative bit. They've subscribed to something called Local Insights that provides tons of data on things like housing and crime and the economy and all of that. And you can map, you can look at those data, you can figure out what the need is, where you are, that might support your grant application. And then ultimately they'll be able to map their data, their voluntary sector data, onto that Local Insights data. That's an amazing innovation that's doing exactly what I've been talking about, which is to gather and store and visualize all of these data about the voluntary sector alongside augmenting it with all this other data that you can get. All right, here we go. Oh God, my palms are sweating. All right, so I've got to say a big thank you to Jen Zhu, who's doing this work as part of his master's. Where is he? UCL. Yeah, UCL. Okay, so he has done this this analysis, local indicators of spatial association. So what he's done is he's looked at the data which we already have on high intensity unpaid care. So this is when people provide care to their family or to somebody unpaid more than 50 hours a week. So it's a huge, this is when people are full-time carers looking after a family member or a friend. And he's used that as a proxy for unmet need. So he said where there's high levels or the highest levels of high intensity unpaid care, that you could read that off as being somewhere where social need isn't being met by some other means, by public services, for example. So then what he's done is he's taken the data on high intensity unpaid care, and he's done something very clever with it to do spatial clustering against indices of multiple deprivation, something called the old age dependency ratio. That's the number of older people who are dependent on care, and population density, to see if there's any pattern there in terms of whether high intensity unpaid care is high, where you have high levels of multiple deprivation, a high old age dependency ratio, or low population density. So that's what he's done. These are the maps. I've got nothing else to say about it, but I know Jen has already written up a draft paper about it. It is really interesting stuff. This is the beauty of working in an interdisciplinary way, which is that you can have someone else go do this stuff and not me, because if it was me, it just wouldn't get done. And then he's moved that on a little bit because he's taken that data and he said maybe we can see the shadow of the microbiome in these data, because you've got these blue areas in Cornwall where you've got high intensity care rates that are lower than you would predict if there was a relationship with ageing and deprivation. So there's high levels of ageing and deprivation, but there's lower high intensity care rates. And the red bits are areas where so that might mean there's a strong microbiome that is successfully absorbing unmet need. And the red bits are where you've got, maybe that's where the microbiome is less well developed, and that is creating a strong relationship between high intensity care rates and the other measures. And I believe he used least squares regression. Okay, all right, I've done that bit now. I don't have to do it. I don't have to do it again. Okay. But really interesting stuff, right? This is I'm really glad he's doing this work, because this question of what you end up doing with these data is really important, and how this is another way of how you might glimpse the importance and strength of the microbiome. It's a, you know, he's having a go for his masters. It's still quite experimental. Anyone who feels like this is in their wheelhouse, you can talk to Mike. Okay. Right, nearly finished. So what do we do to support these organisations? When local infrastructure organisations ask the voluntary sector organisations that they support what they need, you often get things like, we need more volunteers, we need some help with back office functions, we need to do a bit of business planning, we need more grants. There are needs that organisations have. Now, what NASCA have done is they've identified 4 functions of infrastructure, and these basically cover the things that a local infrastructure organisation should do for the organisations they support: leadership, collaboration and partnership, capacity building, and supporting volunteering. And those are the things that these smallest organisations also need. Perhaps not in exactly the same way as a larger organisation, but they still need some of this. They need peer networking, training, a bit of help with, you know, maybe there's a grant coming up and they want to collaborate. They don't know how to apply for grants. They don't know how to find grants. They want to grow. There's all of that going on. And one of the things we were talking about in the meeting I had the other day with Voluntary Sector Forum, Volunteer Cornwall and Active Cornwall, was precisely about, if we take these 4 functions of infrastructure, do we really know what these mean for the very smallest organisations? And we need to do a bit more work on that. And then I've already talked about BNSSG a little bit, but there are really progressive commissioning models coming through that are much more attentive to the heterogeneity and the importance of the voluntary sector. There's the long-standing Wigan deal, which was started in 2011. That's quite a progressive means of identifying need and then trying to grow capacity. There's other examples I could point to, and the one I didn't put on this slide was support for VCSEs to understand and articulate their impact. There's all kinds of things you can do, like social value and social return on investment. They're really hard work, and they often don't work at the scale of the individual organisation if it's very tiny. So how do you do that for a group of organisations? That's another important thing that's starting to bubble up now, because social value is one of the ways you can express impact in a way that funders and commissioners understand. The problem is, the downside is, it can be a lot of work. Okay, I'm going to, that's almost just about right, I think, for some questions. I'm going to say thanks for listening. And of course, if you don't already volunteer, I encourage you to do so. Go down to Tregeniggy Woods and help out, chop up some branches, find the thing that you're really interested in and volunteer for it, because it is, I could do a whole nother talk on how the data on how rewarding and good for you volunteering is. All right, thanks very much.
Thank you so much for a great talk. Okay, let's open the ground for question.
Oh, is this a maths question? I'm not about.
It's not, but it is to do with your residual math. Can you put it back up?
We can, but honestly, I'm not you can definitely ask the question.
No, my question is like anecdotally, like
Okay.
the distribution of the reds and blues. Is that like what you might expect? Even though you know a lot about Cornwall.
You need to go back. You go back to it's that one. And then do you want to scroll down a bit at the bottom now? Yeah, sorry, no, it's up there, sorry, there, it's there. Right, where do we think this is? Right, so, you know where that big red blob is in the middle?
The Bodmin.
Bodmin, yeah, it's around Bodmin. So,
That's mostly fields.
well, yes, and because part of this is population density, so it's, but yes, Bodmin, if you look at the data on indices of multiple deprivation there, what Cornwall's got these deep pockets at the scale of the lower super output areas. That's it's quite a small scale. Got these very deep pockets, and so you get things. This is a bit more generalised, but yeah, that's Cornwall. That's Bodmin. This is getting over towards sort of Saltash and what's the place you know? Got it. Lisgard. Over towards Lisgard. This is that might be Bute actually.
Yeah.
Obviously the lizard.
That Padstow
That's
really,
new
really
key.
dark blue.
You kidding?
That's Newquay. That's Padstow.
That's Padstow, yes.
That's Falmouth. That is
I need to put it on the big screen.
Mal. Is that Newlyn or Malvern? I think that's Mal. That's Newlyn.
Yeah, that's great.
Sorry, I'm sorry. I'll start pointing at the right screen. We just have a guess. That's Falmouth. I think that's Mousel. That the blue one up there is Padstow. That's Newquay, Bodmin, and then up there that orange one's Bude. And then over here you're getting over towards sort of Callington, Lisgard, Saltash way.
Say like the Padstow versus Bodmin difference. Like, is that what you would expect based on?
Well, the thing about Padstow, I'm not sure what Jen's done with the data, but obviously Padstow is also characterised by enormous amounts of second home ownership. So there's not big money there. So the old age dependency ratio is probably not very high, and so maybe, but I mean, Padstow is well off. Falmouth's pretty well off in the grand scheme of things. Mousel's interesting. I think that's probably also because it's absolutely massive amounts of second homes there as well. So we have to think about these days. You know,
It's not just showing deprivation, it's showing.
No, this is it's indices of multiple deprivation, old age dependency ratio, population density.
And then against.
Against the high intensity caregiver, more than 50 hours a week. Any questions? Yes, sorry, John.
Really, so do you know, or has there been any research on what kind of people drive? Because you go to some communities and they've obviously got those guys.
Yes.
You go to others and I don't know, maybe it's all hidden, but you don't
Yeah.
kind of see that there are. And is it people with, I mean, you can imagine if someone's trying to work 3 jobs and bring up kids and stuff, they're not going to be volunteering
Yeah.
with fair enough groups, but are there socioeconomic groups that get involved and drive this stuff, and can you kind of predict?
Maybe I'd have to go and have a run in. I can't remember off the top of my head. I think there is research that shows who volunteers, and there's the age thing. So people who retire, and we have been through a period where people retire early. What you'll notice is some organisations like the National Trust, every so often they get really twitchy about how old their volunteers are in the nicest possible way. But in reality, they've got a constant stream of retirees coming into it. So their average age is quite high, but they've got constant replenishment of that group. The other group who volunteer a lot is people who already have all have experienced the thing they're volunteering for. So it could be a long-term health condition, or it could be some aspect of social deprivation, but they're often not volunteering for that thing. Sports is another one. So yes, the short answer is yes. I couldn't tell you the data off the top of my head, but the question about what the trends are, there's a civil society almanac published every year, and the trends are towards there being fewer volunteers. And we've talked about that, haven't we? And whether that's because, as you say, people are working 2 jobs, life is a lot harder, there's less time, there's less, because almost all volunteers put at least some of their own financial resource into it. They drive somewhere, or they buy some post-it notes, or they, provide the tea and coffee, or whatever it is. And so it might be that is all just getting much more squeezed, and people are working longer as well. Yeah.
In a very specific aspect of this, I did some work on urban green space volunteering.
Right.
Don't actually run it, but it's been published, and there were 5 things that we found. This was in collaboration with the Making Space for Nature project.
Yeah.
5 sort of factors, and I saw you had a realist evaluation thing up there. One of those reports was using that method. So this was using QCA, qualitative comparative analysis. So we found neighbourhood capacity, which was in essence the index of multiple deprivation, combined with landscape quality, because this was to do with urban green space, and with historic relations between the local population or people using the park and the council in particular, and not just this kind of council body. So it wasn't just Cormac. It was also this conglomerate that people viewed as public services, and whether they were doing their duty or not. And then combining with, because this was project based, combined with financial input and whether any interventions increased the sense of place.
Yeah.
So it was completely intermeshed between landscape and neighbourhood capacity. But one thing, so I worked with I met Tregony Woods people, and then one of the main fellows there just totally spoke about it being him and another guy who historically, retirees, but full of capacity, moved in, know how to apply for grants and things like that. And it just coincided with a really great person at Cornwall who could help them with the admin load to get it running.
Exactly.
And that real key leadership person, I think, is it Eleanor Ostrom? Some people have written about how important that person is.
Well, we do talk a lot, don't we, about either the master weaver or the charismatic agent.
Yeah.
The person who knows everybody and brings everybody together. I would say, for example, he might be on the call actually, I hope I'm not that embarrassing, but I would say King Campbell Estate in Fiok Parish. Fiok Parish did loads of stuff. And I think that's, my observation is that that's got a lot to do with Keith's indefatigable energy and commitment. So, and the way he pulls people together, and you know what I mean. So I think that figure is really critical in a lot of cases, that there's somebody with the energy and the commitment and there's a kind of social conscience and wants to do something. And then the question becomes, how do you translate that energy into action through, for example, small amounts of funding? Like Source FM started like that. And now has got that lovely building in Kimberley Park. So how do you create the conditions in which there's a small amount of funding, there's a bit of help, maybe there's a bit of peer support. You don't have to write your own safeguarding policy, because you can go and download one that's really relevant for you, and it was written about your place, so it's got the right contacts in it. And how do you feel? I remember trying to open a bank account for the roller skating group and get an insurance policy, and it was a nightmare. I really needed someone to phone up and go, who do I go to for an insurance policy for a roller skating group?
That was a key thing actually in our neighbourhood capacity. It wasn't just IMD, it was including whether there were existing local gardening groups.
Yeah,
So if
exactly.
there's existing friends are down the way in
Mhm.
Penzance, then
Yeah,
that was a big part.
yeah.
It's okay.
Oh,
Go ahead.
Excellent. I was wondering about thinking about the risk for these volunteering groups, and I can think of quite a few examples where volunteering groups would be like providing support for people in ways that don't, when people would otherwise be advised to go through official channels,
Yeah.
but those channels would be failing them, like in healthcare or support for trans people in the face of anti-trans government legislation. And I'm wondering what's the risk of exposing these support groups to sort of higher authorities so that they're not allowed to
Well,
provide that support.
Indeed, I mean, and this is partly what this is. I'm in general, I don't think the answer to this is get them all registered.
Yeah.
Because I know what that comes with in terms of sucking out the capacity, the energy, and replacing it with the bureaucracy and the paperwork. So there is potential risk there, but I think this is what the local infrastructure organisations are there for. The problem for the local infrastructure organisations is that their infrastructure functions are not revenue generating, and so they also need some support. But and I think there's more work going on to try and think about the relatively small investment that a local authority for them would put into a local infrastructure organisation. The benefits of that, the benefits they reap from a relatively small amount of money are huge. So we can make this happen without formal registration through local infrastructure organisations if they are also well supported.
Just a quick question. How much connection is there between these different groups organically, and how much sharing of knowledge or know-how?
That's potentially anything from lots to none. It depends what they are and who they are. So who was talking about you were talking about the connection to other friends of type groups. The roller skating group was part of Skate Cornwall, so there was connections to those groups. But it really depends. It depends. It's kind of the water they swim in, you know, whether they know of and connect to other groups. But again, that kind of peer networking and support can be facilitated by local infrastructure organisations if they are also really well supported. Spark do that really well in Somerset, for example.
We've reached the end of the hour. Sorry, you have a few more questions. Maybe we'll take them outside, but thank you, Kate, again for a great.
You're welcome. Thank you.
What?